So the main pink vessel is the dorsal aorta, running the length of the body. Subclavian, like this right here, comes underneath this cardinal sinus, comes up, branches into branchial and anterior ventrolateral right here. Celiac artery, the big one that runs next to the hepatic, and the hepatic artery should be right next to the hepatic vein. It's not clearly shown in either one of these charts, but it's in the same bundle of vessels. The anterior intestinal, the one next to the pancreas, is the anterior intestinal artery and vein. This side would be the posterior artery and vein. Hepatic artery, we covered that. Gastric artery would be the pink coming from the stomach, right here. Pancreomesenteric artery is this pink one, headed towards the duodenum. Linogastric, the pink one that goes to the spleen. And anterior mesenteric, pink one that goes to the intestine and then turns into the posterior intestinal artery. Posterior mesenteric, attached to the digitiform gland. Iliac here, coming from the dorsal aorta underneath the sperm sac out to the body. It splits into the posterior ventrolateral, which is right here, and this would come all the way and meet up right here with the iliac.
I lost you right there. Can you do that part again?
So posterior ventrolaterals here meets the iliac, and then the other branch. So here's two branches. The branch that goes this way is posterior ventrolateral. The branch that goes this way is femoral. Intersegmental. These pink ones in the muscle. And then intersegmental veins are the blue ones in the muscle. Caudal artery and vein. The dorsal hole is the artery, the ventral hole is the vein.